Hello. Today I want to talk again about fibromyalgia and by implication chronic fatigue syndrome and how we address it here at the Southern California Rheumatology Research and Treatment Center. I'm Dr. Xavier Caro. You know, the entity of fibromyalgia, as painful it is always difficult for my patients to understand. And in these series of videos, I've tried to explain how the average patient with fibromyalgia has dealt with this disorder their entire lives and doesn't really know it. It manifests itself probably first in early childhood with multiple infections or worse infections than might be expected. This is a manifestation of their incomplete immune system, which theoretically at least, and we have data to show this, is a genetic, inborn, or if you like, inherited tendency on their part. As you may know, the immune system in the adult stays fairly steady for most of the adult's lifetime. The child builds up immunity over time, so their immune system becomes stronger. In late adulthood, that is, in old age, the immune system again becomes more senescent. And this may be part of the reason that the immune system weakens and that we see more fibromyalgia and its complications later in life, the average patient being about 55 years old. Now, we have reviewed the role of the humoral immune system, and particularly the lack of certain components of the humoral immune system, typically subclasses of the immune globulins, which go under the names of things as immunoglobulin G, A, M, and an inflammatory component called mannose-binding lectin. We think that this predisposes the patient to having difficulty handling various kinds of infections. And of course, we know through common everyday experience that our intestines, our gut, our large and small bowel, particularly the large bowel, are loaded with bacteria, forming a constant immune stimulant. Researchers in the area of irritable bowel syndrome have shown that these patients who have a particular propensity to inflammation in the bowel lining have symptoms of bloating, gas, irritability. They may have diarrhea, constipation, and so on. This syndrome, typically referred to as irritable bowel syndrome, is seen very commonly in patients with fibromyalgia. It is interesting to me that many patients who have it, however, are not aware of it. Some patients will tell me, you know, I'm very regular, Dr. Caro. I have a bowel movement every day. And what they don't know is it's really more toward normal to have many bowel movements in one day. These individuals with a single bowel movement, for example, may in fact have subtle signs of irritable bowel syndrome. Patients who have unexplained diarrhea coming and going, sometimes alternating with constipation, probably have irritable bowel syndrome as well. We like to be able to demonstrate that the patient has this objectively if we can. This is difficult to do. There's no perfect test, and almost every test is criticized. Be that as it may, we use the lactulose breath test here routinely to try to determine if patients have evidence of irritable bowel syndrome. This has several real strong points. First, it's relatively easy to perform. Patient comes into the office fasting, has a very small sample of lactulose given to them, and then their breath is measured every 20 minutes for 3 hours. This exhalation of breath is made up in part by gases that are produced in the bowel as bacteria degrade the lactulose. Overproduction of hydrogen and or methane signals to us irritable bowel syndrome. Now, this is important because we believe that the inflammation that occurs, subtle though it may be, in the lining of the bowel, typically the large bowel or the end of the small bowel, then causes hyperstimulation of the immune system or may act directly via the release of cytokines or interleukins into the bloodstream to damage peripheral nervous tissue. It may also damage, we believe, the blood-brain barrier, perhaps even the central nervous system, that is the brain itself. It may very well be that the white matter, those are the connections between our gray matter thinking regions, are damaged by these kinds of chemicals as well. All of this has been shown subtly in various publications and research into patients with fibromyalgia. Turning these down then should help the patient with their symptoms. This is not as easily done as we'd like, however. Typically, we ask patients who have these kinds of symptoms to treat the signs of irritable bowel syndrome using antibiotics. There's any number of antibiotics that can actually work, but for about a year to a year and a half now, the FDA has approved the use of rifaximin. Rifaximin is an extremely expensive antibiotic, but it's also very effective in wiping out the overgrowth of bacteria that occurs in these people who are relatively immune deficient. It may be that this overgrowth occurring in the distal aspect, that is the farthest region of the small bowel, is particularly irritating that area. No one really knows for sure, but that's what we speculate. In any case, reconstituting the proper balance of the bacteria in the bowel, we think, is integral in breaking the fibromyalgia cycle. So we will commonly treat these patients with one antibiotic for a couple of weeks, and then if that's not successful, we may treat them with another antibiotic in combination with the original, that is rifaximin, with some other antibiotic for maybe 2, 3, or even 4 weeks. We have different regimens for different patients and so on. In our experience, improving the overgrowth of bacteria is integral to improving the symptoms of fibromyalgia. Now, having a patient who's had this kind of inflammation, subtle though it may be, for a period of time, they may have already evolved into a more inflammatory state. In our experience, once the patient begins to show signs of inflammation in the bloodstream with elevation in acute phase reactants, then they become tougher to treat. And we may have to actually use anti-inflammatories. These can be oral agents, they can be intravenous agents, injected agents, self-injected agents. They stem the range from corticosteroids, cortisone, prednisone, perhaps you've heard of some of these medications, all the way on up to more powerful biologic agents. Assuming that we are able to get inflammation down and the patient shows evidence of significant nerve injury, then we may, in certain patients, that is a subset of patients who are particularly hard to treat, we may use intravenous immune globulin. Now, this is the same material that we were talking about earlier. It's harvested from normal individuals. It's cleansed, so it's completely sterile, and it is injected after reconstitution in our facility. Injecting immune globulin is fairly standard now, and it's used for a number of different conditions. We find that it's particularly helpful when we have signs of nervous system tissue injury. And if you recall, we talked earlier about finding evidence, objective evidence, of small fiber neuropathy or injury in patients with fibromyalgia by taking a small sample of skin and looking at it in the microscope. We can also find signs suggesting large fiber neuropathy using electrical studies, commonly referred to as EMG. Now, these studies, the patient's symptoms, and sometimes blood tests can be used to track their progress. And typically we see patients whose symptoms abate, the skin fiber count rises, and there may be improvement in large fiber neuropathy findings on electrical studies. I say there may be because we don't repeat the large fibroneuropathy testing very often. It's expensive, it's time-consuming, and it can be painful to the fibromyalgia patient as well as to normal people. In any case, using this approach, we will typically get patients with fibromyalgia to note a great deal of improvement. Now, bear in mind that these treatments get more at the cause of fibromyalgia rather than masking the problem with something that sedates the patient or diminishes nerve pain by dulling the nerve sensations themselves. This gets more at the issue. Whether or not we'll eventually be able to provide the patient a means of producing more immune globulin themselves, or perhaps consuming more immune globulins orally, is something that we're working on even now. Thank you very much.